Hi, my name is Donna Person. I'm a second-year Maryville student. Today I would like to do my head-to-toe physical assessment on my volunteer patient. I will ask him for his consent first. Is it okay if I do a head-to-toe assessment on you?
Yes.
Thank you. I've asked my patient to empty his bladder, get undressed from waist up, put a hospital gown on. I've done a weight and a set of vital signs already. We've done the Rosenberg as well as the Snellen chart for near and far vision, and that has been completed. I will start with inspection of the head and face. I'm looking at his skin to make sure his skin is nice and even toned. There are no bumps or bruises. I'm looking at his eyes. I'll ask you to close your eyes, sir, and open them, not to squeeze them, just close them, please, and open. Looking at the eyelashes to make sure they extend out. I'm looking for his nose to be midline, his lips, ears are symmetrical to his face. Now we will go ahead and go to, I'll do the cranial nerves 2, 3, 4, and 6. Would you please close your eyes shut tight? Would you clench your teeth? Would you stick out your tongue? Poke out your cheeks with air? Okay. And then smile. All right. Did you, yeah, really frown for me. Make a frown. All right, very good. All right. Next, I will check your temporal mandibular joint. Right here. Open your mouth wide. Okay, and close them. And what I'm checking for is the movement of that joint there to make sure it goes up and down evenly and comes back. All right. Next, we'll go ahead and do the eyes. Okay. Well, let's go ahead and do your facial bones. I'll palpate facial bones, and then I'll do your sinuses, frontal sinuses, your ethmoid and sphenoid sinuses, as well as your maxillary sinuses. If there's any pain there while I'm palpating, please let me know. Was there any pain?
No.
Okay. And then let's go ahead and do the lymph nodes, preauricular, post-auricular, tonsillar, submandibular, submental, occipital, post-cervical, deep cervical, and your cervical chain, as well as your supraclavicle. Is there any pain with palpating those nodes? Let's check and see if they're not swollen or tender.
No.
Okay. Next, I'll go ahead and do your eyes. I will look in your eyes for your conjunctiva as well as your sclera. Let me use my light. Okay. Eyes up to the left, right. I'm checking all around in each eye, and making sure that the sclera and conjunctiva are nice and white. All right. The next we'll do, I will check your pupillary reflex. Okay. Look straight ahead at a point on the wall, and I will look into your eyes. Okay. We'll check for direct, and then concentric. And we'll check for direct pupillary response, and then concentric of the other eye pupillary response. All right, I would like to check your lacrimal duct. The gland is here, but the duct is here. And let me know if there's any pain in that lacrimal area.
No.
Okay. Next, we will do the sixth cardinal view or gaze. I'll ask you to look straight on that wall. And then you follow my pen just with your eyes. Okay? Very good. The next thing I will do is called a cover and an uncover test. This test will check to see if when I cover your eye and uncover it, if there's nystagmus or strabismus or extra movement in that eye. So look straight ahead, and I will cover your eye, and I'll move, cover, looking at the other eye, and then check and see if there's any abnormal movement. I will cover your eye, uncover, cover, uncover. Okay, very good. Next, I will use my ophthalmoscope and checking for the red reflex. All right. I will brace my hand here and move in slow to the patient's eye, looking for the red eye reflex and the vessels in the eye. I will do the other side, but to save time, I will not. Next, I'll go ahead and go to the ears. First, I will inspect his ears just to see if they're symmetrical to his face. I'll palpate the auricle all around, look behind the ears. Okay. And they feel fine. There's no drainage or scaling or out of the ear. Next, we will do the hearing or whisper test. I will go behind the patient and whisper a common word, and he will repeat the word. Could you please cover your right ear?
Apple.
Cover your left ear.
Orange.
Okay. And that is the whisper test. The next thing I will do is the Weber and the Renin test. I will use my tuning fork. I will strike it. I'll put it on top of your head. Please let me know if you hear sound in just the right ear, just the left ear, or both ears. The patient should hear the sound in both ears. Tell me when you hear the sound.
I hear it in both ears.
That is considered the Weber test. We will now do the Renin test. This test, you strike the tuning fork, put it on the mastoid bone, and the patient should hear the sound, and then he will tell me when he no longer hears the sound, then we will move it about an inch from the ear, and then he should still hear the sound and let me know when you don't. And the conduction is 2 times longer than the bone conduction for air.
I hear it. I don't hear it anymore.
That is the Renin test. I will also do the sensation test, and you tell me where you close your eyes and where you feel the touch on your face.
Forehead, cheek, left cheek, chin.
Okay. Next, we will go ahead and inspect his nasal septum, his nose, and I will look and make sure that the septum is midline. The bones are nice and strong. You don't feel any tenderness here, do you?
No.
Then I'll do use my pen light to look inside and look around. Okay, tilt your head back, and I'm looking for patency. I'm looking for his mucosa to be nice and pink. The turbinates, superior, middle, and inferior turbinates. The nasal septum, making sure there's no drainage or anything like that on the nose. Next, I will ask you to occlude one nostril and smell or sniff the other one. And and that's to check the patency of the nose. Next, I will check your inside of your ears for your, looking for the tympanic membrane, and it should be a pearly gray. I'll use my otoscope. And then I will check the inside of his ear. And I can view the tympanic membrane. It is pearly gray. There was no drainage or bulging or redness inside the ear. We'll go ahead and do the mouth. I'll inspect your lips, making sure they're nice and moist, no cracking or dryness around the edges, and I don't see any. I'll ask you to open your mouth. I'll take a look around at your mucosa, your buccal mucosa, your left and the right side, under your tongue, and on the side of your tongue, the hard palate, soft palate, and stick your tongue out, checking to see if there's dryness. That will be a sign of dehydration. I will check your teeth, the clarity, consistency, and numbering them. And I will also smell the breath to make sure that there's no odor from the breath. Right. I checked your gums. Oh, I know one thing you didn't check. Your tonsils, and I need your gag reflex. Stick your tongue out. Good. The uvula moves, and then check the gag reflex. All right. Now we will do your neck. First, I want to inspect your neck, looking for the color, making sure that there's no bruising or bumps. Then I will palpate the neck. Okay. I will go behind you. I need to palpate the thyroid. And I do not feel it, even though we will palpate it. Okay. I'll let you turn your head to your right. I will check for jugular vein distension or palpation, and it will be in this area here. Got a triangle move right in here, and there is none. I'll check the other side also. Then I will go ahead and feel for the carotid pulses, one at a time. Next, I will auscultate his thyroid. I will also auscultate the carotid pulses, listening for bruit. Okay. Next, we will do passive and active range of motions for the neck. If you will tilt your head to your left, tilt your head to the right. And then now I will ask you to tilt your head against my hand and tilt your head against my hand this way. Shrug your shoulders, and that is checking the 11th cranial nerve there. Okay, next we will check the trachea for midline and also to swallow. You check it. It should be right here. I'll ask him to swallow. Very good. All right. Next we will go ahead and do the anterior posterior chest. I'll ask you to turn around. Okay, this is, I will inspect his back, making sure that the color and there's no his respirations are even and unlabored. There's no difficulty with breathing, and I notice that there are none. I will ask you to put your arms across your chest this way and bend over just a little bit. Next, I will percuss his lung sounds. After percussing the lung sounds, I will go ahead and auscultate his lung sounds. Okay. Deep breath in. Okay. Okay. You can hold your arms up straight over your head. I will do the lateral percussion in a systematic way. I will also percuss those sounds. Auscultate. I would like to check for his lung expansion. It's about to T10 or 11. I put my thumbs together and ask you to take a deep breath, and I will watch for the movement of his chest evenly. Then I will check for a tactile phymatist. I will ask the patient to say E. You can feel with either the ulnar sides of your hand or the palm sides. We will use the palms. Okay, go ahead and say E.
E. E. E. E.
We will also check for the costal vertebral angle, which is here. I will also check to see that his thoracic or his lumbar area is in good alignment. And here's the cervical, thoracic, lumbar, and sacral, and it is. Next, we will do diaphragmatic excursion will be our next one. And doing the diaphragmatic excursion, can you see it there? It's done this way. We'll palpate down until we hear a sound change. I will mark that area and then go up and hear a sound change, and I will use a marker and mark here, and it should be a 3 to 5 centimeter difference here. I would do it on this side, but to save time. And the right side should be a little higher up than the left side. Okay, you can turn back around. Okay, now we will do the anterior chest. First, I will inspect his chest to make sure that there is no, his respirations are even and unlabored. I get down low to see if I see any palpations or heaves or anything like that. Then I will percuss. I'm going to listen for your tactile phymatist anteriorly and ask you to say E.
E. E.
And here.
E.
And laterally.
E.
Okay. Next, I will listen to your heart tones. I'll listen to your aorta, the pulmonic, second intercostal left, Herb's point, third intercostal left, tricuspid, fourth intercostal space left, and then mitral, fifth intercostal space, midclavicular line. I will palpate the point of maximum endpoint for the apical pulse, and that is fifth intercostal space, midclavicular line, and you should be able to feel it. If not, you have the patient turn on their left side, and then it will bring the apex to the front of the chest, and you can feel the apical pulse that way. Next, we will do, let me check your arms. I will feel his skin for warmth, making sure they're dry, no edema. I'll turn his hands over, looking at the palms of the hands, making sure that they're dry and there's no oh gosh. I'll check the insides of his hands and feel for them. I will also feel for his radial pulse and the brachial pulse. And the radial and the brachial pulse. And the temperature. They're nice and warm and dry. I will check his fingernails. I will check for capillary refill. Checking the nails to see if they're brittle or broken. And then I will check for the clubbing of the nails. And how you do that, you put your nails together and you will see if there's clubbing on the nails. It should be less than 180 degrees on the nail when you put them together. Okay. Next, I will check for your range of motion. I will ask you to hold your hands this way and push against, and don't let me pull. Very good. All right, sir, you can lay down. We'll check your abdomen. Okay, I will inspect the abdomen for its girth, the skin, the contour of it, and then I will look to see if he's having labored respirations, which he's not. And then I will listen for his bowel sounds in all four quads. All right. Now I will palpate the abdomen. Is there any tenderness? Then I will palpate his liver borders. And you do that by up. And then when you notice the sound change, you mark. And then percuss. And then I will mark, and there should be a 5 to 6 centimeters of the palpating of the anterior and posterior liver border. I will also percuss the spleen. Then I will check his kidneys on each side. well. I will listen for his arteries, renal, iliac, and femoral. I will also palpate for the aorta, and I will deep palpate the abdomen. I will listen for the aorta. Okay. Now I'll do your legs, lower extremities. I will look at the hair distribution on the leg, feel for the temperature, the skin, the muscle mass in the legs. I'll feel for his popliteal pulses, dorsalis pedis, post-tibial. I will also check his reflexes. Okay. And then I will check his knee reflex. You have to sit up there. Checking to see if there's, when he sits up, for the edema in his legs or his feet. And then I will check for the reflex here. And then I will check for his Achilles tendon. And that's the end of my conclusion of my head to toe assessment, and thank you for looking.